Hi, and welcome to the Fortify Your Brain Summit. I'm Betsy Schroeder, your host, and today I have as my guest Artour. If I said that right. And Dr. Rekimov is a scientist, a writer, a breathing teacher, a trainer of practitioners. He is the creator of the amazing DIY breathing device and the author of 11 Amazon books and the world's largest website devoted to breathing retraining. Welcome, Dr. Rekimov.
Yeah, thank you, Betsy. Thank you very much for inviting me as well.
Yeah, so happy to have you. So tell us a little bit about how you got started in working with the breath.
Well, a long time ago, like a bit more than 20 years now, I had various health problems which I could not solve with many other techniques like having very long sleep, up to 10, 11 hours, a lot of chronic fatigue, having very large fluctuations in blood sugar levels in and out, numerous infections, especially during winter times. You know, I was athletic all my life, and what happened there that I could have infection nearly every week, and that would be like devastating with very high temperature, you know, like 39 degrees Fahrenheit, probably would be 106, 7, 8, like very high, a lot of like fever, sore throat, coughing, and could last for 3, 4, 5 days. Later I recover and I try again, go running in winter time. I lived in Canada at this time already. And so what happened that I get infections again. So it was very kind of frustrating, all these problems together. And I was looking for various approaches. I had water fast for various durations, 3, 5, 7, 12, 15 days only on water. Many other techniques, alternative health. I was going to library in Toronto. There are a lot of libraries, so I would pick up like stack of alternative health books. Many books were written by even like medical doctors as well. And trying to study, research, and could not find anything. Eventually I found a book, and at this time I was in the UK, in England, and the book was about this breathing technique from Russia, where I'm originally from. So Russian became my main language, and I read it in English. I started to try like the tests, the exercises that they suggested, and it worked miraculously well. Like in a few days' time, I got more improvements than I had like during previous years of trying like all other techniques. So I was really fascinated. I could start running. I would be able to run through the nose, and like a week later was already like huge improvements. Sleep get down to 7 hours very fast. Quality way better, of course, improved. I did not know I was sleeping on the back a lot. I had mouth breathing at night as well, breathing through the mouth at night. So I learned these techniques, how to prevent them. And then I discovered a lot of information already in Russian by Russian doctors Soviet doctor Buteyko. He developed this method of breathing retraining. And that's why I have also Buteyko table of health zones, which maybe I can refer a little bit later about. Yeah, just a lot of information in Russian. And I became kind of, I see myself maybe in a way a bridge, because there were communities of people as well as practitioners, forums of practitioners, where they were discussing this technique. They also a lot of successful stories, testimonials of people, and also questions like, and what I myself discovered, there was a lot of information available in Russian language, including clinical trials, including maybe some interviews of Dr. Buteyko, and manuals, more kind of details, more specific details about application of the method, as well as for different health conditions. Because in Russia, in Soviet Union, not in Russia, in Ukraine, but that was again part of Soviet Union, we had an amazing clinical trial on cancer, for example, where we reduced mortality by 6 times using the reduced breathing method, because the doctor who organized this clinical trial, he was a student of Dr. Buteyko. So Dr. Buteyko trained him how to use this technique. And that was way better. Like later I found way better than chemotherapy, radiation, which may have like maybe 10, 20% extension of reduction of mortality, and also extension of life, like in terms of numbers. And maybe 50% there is single drug I know for breast cancer, which has very high success rate, 50% reduction in mortality. But this technique does not involve any medication, and it can be used even together with chemotherapy and radiation and surgery, and it still gives 6 times reduction in mortality for early stages of cancer. So that was really like a kind of fascinating. Plus we had clinical trials on whatever, HIV, AIDS, liver cirrhosis, hepatitis, not just like asthma, hypertension. That was well studied, and this is what this method is well known for, like again, for particularly for asthma around the world. And to some degree also, let's say heart disease, hypertension, it's also quite known. But in Russia, we had doctors practicing it with diabetes, hormonal doctors, hypothyroidism, and many, like basically Buteyko discovered that 200 diseases are connected with our breathing, and these are lifestyle diseases, so-called diseases of civilization, which particularly like their rate increased during last 100 years. And that relates diseases which kill, by like modern statistics, 70% of modern population actually are going to die, and people who are dying now, they are so-called non-contagious diseases. And that's again 4 main killers, which is again cancer, heart-related conditions, diabetes and metabolic conditions, and asthma, COPD, emphysema, respiratory conditions. So these 4 conditions, of course, they are known statistically all over the world as the main killers. And this method particularly addresses it in a way that it's actually allows us to always predict and say that these people actually going to have dramatic improvements in health, reduction or complete elimination of medication if we improve their health to certain degrees. And that means like this therapy works, like virtually always works for all type of conditions, but it's extremely hard in terms of making changes, because what we want to change, I'm not talking now, of course, about like doing some breathing exercises, but what we want to change your basal or automatic or unconscious breathing pattern, which is going on like day and night, basically, like we breathe all the time. Of course, most people never pay attention to their breath. But Dr. Buteyko discovered that sick people, they have very heavier breathing than the norm. And if somebody wants to check it, I have more than 30 studies on my homepage, normalbreathing.org, where people can see a very large table showing exact numbers from Western research that sick people indeed breathe 2.5, maybe 3 times more than the medical norm. So every minute at rest, we need much more air to breathe. Not only that, that's kind of one part of the problem in a way. Another big part of the problem is that most people believe, since I spoke with thousands of people, that breathing more air is beneficial because they believe you get more oxygen. So that's a very popular superstition and myth that exists in general population. You can see sometimes like all type of signs, you know, like on bags, you know, on clothes, on maybe some shops, you know, like posters, breathe deeper, breathe like more. Yeah, it's extremely common. And this is exactly what Dr. Buteyko criticized, because he was many times on national TV, and eventually actually there was an order of the Minister of Health somewhere around like probably 25, a little bit more years ago, when the Minister of Health ordered to stop deep breathing gymnastic, because in Soviet times, like let's say in 70s and 80s, all type of educational establishments, let's say middle school, junior schools, high schools, Boy Scout camps, universities, colleges, like different like fitness centers. So what fitness instructors would do and other people would do, they would teach, take deep breath in, deep breath out, exhale, deep breath in. So we would kind of force people to hyperventilate. So that was officially stopped in Soviet times by the order of Ministry of Health because of the Buteyko method. And the Buteyko method was kind of officially approved and recognized for the treatment of asthma. So that was like part of the history, how it started in the Soviet Union and Russia, like in terms of being very popular. I believe it's actually now probably plays a key role, because I don't know if many people know that currently, like it's known, like when COVID, for example, coronavirus came to Spain, France, Italy, the mortality was very high, about 10%. So that's extremely high for let's say flu, influenza virus. But when it came to Russia, and Russia now I think on the 3rd or 4th place by the number of people who get infected, the mortality was about 1%. So it was way lower. Like there's few countries, maybe 5-7%, like Germany, some others, but Russia was somehow way lower. And my understanding that it's actually very likely that the familiarity of general population and paramedics and health professionals about negative effects of hyperventilation due to this kind of prophylactic and educational work of Dr. Buteyko. And there is Moscow clinic now where 5 doctors still teach only the Buteyko breathing method. Familiarity of like general population probably makes biggest difference, because we put people on mechanical ventilation. It's known when we have like this COVID virus, when we start to complain, my breathing is now too heavy, too much, it's heavy to breathe, and then okay, we say let us put on mechanical ventilation, and then chances of mortality gets extremely high, because when people already on ventilation, like you can speak with doctors, other professionals, we would say that that's actually kind of really a very bad situation for a person, you know, like very critical.
Wow, that's incredible. I mean, that makes sense. So your website is normalbreathing.org. So how is it that people forget this normal breathing and get dysregulated? What's gone wrong?
Yeah, well, the normal breathing itself, like if we take medical or physiological textbooks, which doctors or students use like in medical colleges or institutes, what happens that this norm was established about more than 100 years ago already. And so at this time, people had very different breathing pattern. So at this time, what happens, I think it was I think Oxford University, where we took 50 or 60 normal ordinary subjects, and we just measured how we breathe. We measured the minute ventilation, how many liters per minute we require, carbon dioxide level, how much CO2 in the arterial blood, breathing frequencies. But these numbers could be found in many other publications, because there were already studies done probably down to 150, 160 years ago, very old time, when we already had equipment to measure minute ventilation and other respiratory parameters. That was also a time like late 19th century when first medical textbooks on respiration were written. Yandel Henderson, John Haldane, there were like certain researchers from Yale University who wrote these textbooks, and they suggested this norm for breath that was common just for ordinary people. And that's, of course, it's also known that, again, mortality from all these diseases of civilization, including diseases of the brain, be it, for example, brain tumors or some other problems or problems related to mental, psychological areas. We were, Alzheimer, Parkinson's, of course, as well, even were not known at this time. Therefore, what happens that the norm that was established just reflected common breathing patterns existing in ordinary or healthy people. Now, if we say, if we ask, you ask like why people forgot normal breathing, my answer would be that actually modern people, when we are born, and since we are born, we are already born in conditions of hyperventilation, because if mother hyperventilates who gives birth, the child would be also having this effect present, meaning that actually modern people, we never have normal breathing. So that makes it a bit like hard even to kind of to believe to these people that, for example, they can do physical exercise and enjoy physical exercise, because most people would say that we all their life, when we try to do physical exercise, we found it's hard, you know, we need to apply efforts, and later we often feel worse. So therefore, like there are kind of certain negative kind of attitude, which is quite prevalent in general population, although there are, of course, a lot of people who go to gyms, you know, those who become athletes and so on. But in general, I would say people don't like it, because I know from ordinary students, especially, again, like if they live in cities, it's common to have a very low amount of total physical exercise. Like if we take accumulative time we spent on walking, a simple activity as walking, like maybe to the car, to the bus stop, in subways, shopping, and so on. It's often very low, commonly very low, maybe 20, 30, 40 minutes, 50 minutes. So it would be not so many people who have even 1 hour of walking every day, like as a regular part of their lifestyle. So, and that's according to Dr. Buteyko and according to Soviet doctors, and I completely agree with this idea, was probably the key central factor, actually, physical exercise, why people in the past were so much healthier. That of course combines with another factor, because people in the past, they would never breathe through the nose. So when people have very healthy, very slow or light breathing at rest, they correspondingly have little light breath during physical exercise, and that allows them to do physical exercise with nose breathing. Even when we have very intensive exercise, we can continue to breathe through the nose. We find it most comfortable on the one side, and on the other side, there was it's known that if you like take, let's say, Oxford dictionary from 70, 80, 90 years old, like old dictionary. So you can look Urban Dictionary these days and look for the word mouth breather.
Oh,
Now,
yeah.
this is how people breathe. And many people would be shocked, like the mouth breather actually was a synonym with such words as moron, imbecile, stupid person. So that was perception in the past, like some people were, I believe, more observant, when, like, let's say 100 years ago and before, meaning that if they see that somebody started to breathe through the mouth, we would just realize that like something is definitely not right with this person, like something is, so that's why it has these synonyms, you know, this word mouth breather. So for Buteyko method, this is what Dr. Buteyko discovered in the 60s, that physical exercise also should be done with nose breathing all the time. And I already mentioned, like my own example at the beginning, that mouth breathing at night. That's another very kind of common feature in the modern population, because I know a lot of people, and especially the heavy way breathing, like the heavy way breathe, the more likely the chances that we have mouth open at night. We wake up, we have dry mouth, we need to drink water, and that causes absolutely like devastating effects on health, because carbon dioxide is removed faster. There is like nitric oxide is not utilized, produced in sinuses. Your lungs, therefore, are not sterilized by nitric oxide. Air is not humidified. Air does not get warmer when you breathe through the nose, through the mouth. It's all opposite negative effects. And that, because of that, it causes, again, like a lot of various negative effects. So that people actually all day feel abnormal after sleeping, maybe even just 1-2 hours with mouth breathing during night, during sleep.
So if you're doing these exercises during the day, does that help with the mouth breathing at night, or do you like keep your mouth
yes.
at night, or how
yes, yeah, exactly. Both ways helpful. Yeah. Sometimes there are people who have not nose completely blocked due to vegetation, or it's zero breathing through the nose for years sometimes. So that can be also the case occasionally. But you're right, both ways are possible. In 1960s, like patients of Dr. Buteyko, they developed a method how to tape mouth at night, because we realized that actually it's such a bad effects of mouth breathing at night. And later it became popular. Now it's known, like it's a lot of people use it around the world, even without knowing that it's originally was a part of the Buteyko method. Now, of course, at the same time, it's true, you're right, that when people not only do breathing exercise, but also lifestyle changes in general, which allows to slow down breathing to get like closer to the medical norm, that already also makes small changes in your automatic or unconscious breathing. And as a result, you see, if you breathe slow and lighter all day long, you go to sleep, of course, by like kind of by inertia, you would continue to breathe slow and lighter during the sleep. So, and therefore, you probably would reduce time when you have mouth breathing during sleep. That's one factor. And another factor would be also that, of course, when you progress, so you have better and better control of your breath. So eventually it would be like, can be reduced to nothing. And we know exactly when it happens if we start to measure breathing. So basically, I can tell that if you breathe more than twice the norm, then there is very high likelihood that you are going to open your mouth. But if you breathe, let's say, not twice the norm or less than that, it's already very likely that you would breathe all the night through your nose, naturally, like by your by your body. Just because you breathe slower, lighter, like there is no need to open. You see, when you breathe less, what happens, main effects relates to carbon dioxide. So, and carbon dioxide, this is like what was found in physiology, again, like more than 100 years ago, probably 120, 30 years ago and before. There were studies already saying that in physiology, by doctors, of course, saying that when people hyperventilate, they get less oxygen content, less oxygen concentration in tissues of the body. So, and later it was confirmed on virtually all vital organs, kidney, liver, brain, heart, spleen, colon, like there are separate studies and many studies on each organ where they measure it and confirm that when people have heavy breathing, they get less oxygen and less blood supply. to all these vital organs, and brain, of course, included. Brain oxygenation is actually so, I believe, extremely important factor. It's so important that when people open a normal breathing.org, the very first image that we see on the top of the site would be two brains, and it shows brain oxygenation. I don't know, many people may see like these colored images of the brain when we do like PET scan.
Yeah.
And so what we do, we actually tell us how much oxygen in different points of the brain, and this is just one cross-section of the brain. So in different points of the brain, depending on the activity of the brain, allocation of blood vessels. But what happens there, so there is one brain image which has like kind of shining, almost like a sun with a lot of like yellow colors, you know, like this type of warm colors. And after 1 minute of hyperventilation, like voluntary hyperventilation, there is the same brain, the same person, just 1 minute later. And the brain oxygenation goes about 2 times down, just because of hyperventilation.
Oh, wow.
So that's why people can faint or pass out in 2-3 minutes. Like if you start to hyperventilate forcefully 2-3 minutes, that's brain tries to like preserve its own basically it tries to preserve the life of the whole body, so that the conscious brain cannot function any longer because oxygen supply is extremely low. But other parts which let's say first of all control your breath and control work of your heart, so like autonomous parts of the brain, they continue to function on remaining oxygen. That's the reason why we faint. So we cannot think consciously, but the body, like, of course, I believe would be extremely common situation for like humans living ago, and even for other animals as well, to have it like kind of suffocation, drowning, all these experiences, you know, to survive longer in these extreme circumstances. So it's like nature kind of was familiar with these events in the past, and that's why humans kind of inherited this specific quality, so that when we hyperventilate forcefully, we just faint, but our body still survive. Later, people generally recover from voluntary hyperventilation. But what we know from Dr. Buteyko, and again, a lot of Western research, more than 90% of people die in conditions of severe hyperventilation. So when people die from all type of cancer, like last stages of cancer, people die from severe heart attack, asthma attacks, like acute episodes, both, and chronic conditions as well. Even like, let's say, diabetes, because people don't die directly from diabetes. Usually they die from complications. That could be like sepsis, gangrene, you know, like kind of bacteremia. There is already blood in the bacteria or pathogens in blood and so on. So, but in these conditions, people's breathing is extremely heavy. And this is how Dr. Buteyko discovered this method, because he noticed that before deaths, actually, people start to breathe more faster and deeper. And I often refer to his table because he developed this in 1960s, but there are modern studies saying that people would have more than 30 breaths a minute. You see, 30 breaths a minute. It's right before death here, because normally it's 12 breaths a minute, medical norm, 12 breaths a minute at rest for a 70 kilogram adult. So of course, weight would not influence, so it would be the same 12 breaths a minute if people were heavier or lighter. But, and therefore, you see, like when people, of course, have heavy breathing, what happens? We breathe deeper, we take more air for one breath, but we also breathe faster. So it happens at the same time. This is how automatic one conscious breathing change. So therefore, the idea behind the Buteyko method is to slow down your breath, meaning that you start to breathe slower with less frequency, but also taking less air per one breath. Because normal tidal volume, the amount of air we need, it's very small, only ½ liter. So that's medical norm. And when people have heavy breathing, we would commonly take 700, 800, 900 milliliters, almost 1 liter. So almost twice more air we can take when people breathe, again, heavy and faster at the same time. And that's why we have such large ventilation, minute ventilation. So ordinary asthmatics, for example, most commonly have 15 liters. I mean, people with heart disease also about 15 liters of air instead of 6. It's, of course, we breathe way, way above the norm. And that's why we have also low carbon dioxide. If we measure how much CO2 we have, the numbers would be also much less than the medical norm.
Yeah, actually, can you explain that? Because I think people think of CO2 as just being like, we want to get rid of it, you know, like that.
It's true, yeah. It's I read many yoga books which exactly say this phrase. So you have to expel like each each ounce of carbon dioxide and get like oxygen that is vitalizing and necessary for health. Yeah, this is exactly popular books, very popular, especially in the Western culture, actually, not so much in India, you know, or Russia, for example. What happens, carbon dioxide is crucial for health. And if it gets down to 3% here, 3%, we die. And that was known long ago because experiments were done on dogs who would be forced to hyperventilate. Actually,
Okay.
Yandel Henderson was with Yale University who did these experiments. It was 1905, 1906, very, very long time ago, of course. And that was a time when we discovered that carbon dioxide is crucial for health. So, and in medicine, nobody would tell that carbon dioxide is a poison or it's not, it's like, is not required for health, for example, would never tell. What is, of course, true that if this air has only carbon dioxide, it's extremely toxic and it would cause extreme shock in humans. So we would die very quickly, but that's because it's extremely high concentration. So even, let's say even 9–10% of carbon dioxide in the outer air would felt as a very toxic, like you would feel that this air is like absolutely awful if it happens. But in real life on Earth, like, that cannot be created unless like you have nothing to, you know, no air exchange at all. So if you like kind of really like in case of suffocation, kill human, but there is like certain normal ranges. And what happens again with modern humans, if we look at a lot of research, again, I have like historical graph on the homepage again, little below of normalbreathing.org. If you scroll down, you see historical graph showing how breathing change in ordinary people, so-called normal subjects. It's not people who have diseases. So we're talking about just ordinary people. And that you can see there, like it was 100 years ago, somewhere around 5 liters a minute, 5.5. Some studies can have even less than 5 liters a minute. 6 is a norm. And now it's 12. And it's 12 already for decades, starting from about 60s, 70s, 80s. So it's already the time when people's breathing became heavy. And I think it probably get a little bit worse after each decade, like if we talk about like recent decades, so just a little bit probably worse. But again, like 70% die of health conditions, which according to Dr. Buteyko, and my experience is the same. If people are able to retrain their breath, we would always manage to get rid of these symptoms. If we have any symptoms related to them, a medication would be unnecessary. And we would not have diagnosis if doctors do tests, like whatever tests could be done, like whatever the conditions is, diabetes, heart disease, or whatever tests we require, we would be normal if people manage to make a change. But to make a change is really quite a big challenge. And I can explain why. Like, let's say in the Buteyko method, the main test that our students do is called control post test. I also call it body oxygen test. So body oxygen test, because Dr. Buteyko, in his 1968 lecture to Moscow State University scientists, he was invited to give this lecture to leading scientists in Moscow. He told that oxygen content in the body can be measured using a simple method. After exhalation, observe how long a person can hold their breath without stress. So that means you sit down, you exhale, your usual normal, ordinary exhalation. After you have usual exhale, it's very hard test. You need to exhale, because if you inhale, you get way better results. So you would not get the right result. So you have to, because some people may be too competitive. They want to get better results. Often happens. So exhale, usual exhalation, pinch the nose, count only until the first stress, which later again starts to grow, would be more stress. People can put themselves twice longer. We don't want it. We want only stress-free time. So this stress-free time has very good correlation with your oxygen content in the body. Physiologically, it's the parameter which reflects your sensitivity to carbon dioxide. This is like what respirologists would say, and I completely agree with that. But at the same time, due to the way how the respiratory system functions, it also reflects with the same accuracy how much oxygen we have. And for practical application, I like to tell more to people about oxygen already, like for last more than 10 years. So, because in the past also I would explain things differently. Now, so if you do this breath holding time test, what we know from medical research that 100 years ago, it was true that the results for this test were very good. So people would have, I have studies on my site from somewhere like 1910, 1920s, a long time ago, because the test required just watches, and there were many doctors who would measure breath holding time in their patients. So they would say that it was common to have 40, 50 seconds. And that health level 5, and this health level 5 exactly corresponds to the official medical norm, which I already mentioned, like 6 liters per minute, 12 breaths a minute. So that's official medical norm, health level 5. Now, modern people, and I did this test with thousands of people, ordinary people who have not so many health complaints, maybe some minor, would have about 20, maybe 15, somewhere between 15 and 20 seconds. There would be very few people like who have, for example, 30 seconds. In 100, I don't know, probably just maybe 3, 4, 5 people would be very few who are like really healthy in terms of how much oxygen we have and how light is their breath. Now, if we talk about people who are sicker, let's say people who have cancer, like in my experience, would always have around 10 seconds for this test. And if it's metastasized cancer, if it's last stages of cancer, it would be 5. And that's why if we look again, for example, research on cancer, including brain cancer, for example, we would have 30 breaths a minute and 100 for the pulse. See, pulse goes higher too. When people hyperventilate, the heart rate at rest gets bigger, 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 and bigger. The heavier we breathe at rest, this is the pulse. Pulse in minute, respiratory frequency. So frequency becomes higher, we breathe faster, more breaths, day and night. At night would be about the same parameters. Pulse becomes higher and higher. And for studies, they show that actually this is when people can die easily, like chances of dying from, again, severe, not only last stages of cancer, I found the same study, cystic fibrosis, HIV. So other conditions would have similar parameters, and very called palliative studies, when we do the care, like when we care about dying people, because this is what nurses would often measure, because we don't have equipment, but we can measure pulse, we can see respiratory rate. These are like 2 of the 3 parameters, and edema, for example, in cancer, these are 3 known, worldwide accepted parameters, which would tell about the state of the cancer patient. It would be pulse, frequency, breathing frequency, and presence of swelling or edema. So, like going to brain, first of all, needs oxygen, it needs good blood supply, so it needs nutrients. Not only that, what we know already for many, many decades with a lot of research, that carbon dioxide helps the nerve cells to function normally. And when we hyperventilate, that naturally causes appearance of all type of abnormalities. Let's say, probably anybody can imagine that or had this experience. Let's say you get a flu, influenza, you have fever, high temperature, feeling miserable, like flu is quite common. Probably most people have it like at least once per year, maybe during winter season or other times. So what happens at this time with breath, particularly interesting, because you see, at this kind of very poor health state and people feel weak, a lot of fatigue, the breath gets heavy almost twice. And the breath holding time would drop. Let's say we were relatively healthy, having 20 seconds. It would go down to about 10, which anybody can easy to measure. I myself, by the way, started at about 10 as well. And that was a situation when I had these totally weekly infections, totally miserable in winter time when it's cold. I would try to go running and I get like 3-4 days nearly dead, nose completely blocked, sore throat, high temperature, like really. And so people would notice breathing heavier and breath holding time goes to 10. Now, going back to brain and sleep, most people notice that at this time, sleep gets way worse, much harder to fall asleep, because brain becomes like a Christmas tree. So you breathe twice heavier, let's say, when you have flu, infection, poisoning, maybe food poisoning, maybe some other like events which causes you to be in a state of like pain or kind of distress. So breathing would be heavier, and therefore your sleep quality would be way worse. For most people, it would be very strong correlation. We would need longer time to sleep. And in addition to that, as I mentioned, the time which we require in order to fall asleep would be much, much longer. Ordinary people, I would say, probably may need between maybe 5-10 minutes to fall asleep. But what we know, if a person retrains their breath, it's actually the time which we need to sleep, let's say at the level of about 60 seconds breath holding time. And this is Dr. Buteyko norm. It's a little bit different. It's also kind of medical norm for me because Dr. Buteyko was a medical doctor. So, and he established his norm, which is a different, because medical norm corresponds to health level 5, as I already mentioned. And these are the parameters. And Dr. Buteyko for this body oxygen test is 60 seconds as standard. 8 breaths a minute at rest. When you sleep, for example, you're supposed to have even slower, lighter breath. So at this stage, we know that people actually fall asleep. I remember, like I asked many students, we would say 1 minute or less. We literally put their head and fell asleep very, very fast. Now, not only that, what we found again, like with tens of students that I had, because that's actually quite a challenging thing to achieve. And I know that most practitioners do not have even 40 seconds in the morning. It's actually, we have parameters which would be way, way less. People who teach the method, I mean, in the Western world. But when students get to this level, what happens? The sleep gets down commonly to 4 hours. Rarely would be few people who have 5. See, sleep gets short. I mean, naturally, people don't force themselves, you know, we don't restrict their sleep. We just wake up 4 hours later and we're like totally fresh. We feel that we need no sleep anymore. And that was like fascinating kind of part of the method, because this relates directly to brain as well, because like there is a general belief in many books I read, like in alternative health, they say that sleep is necessary to recover, you know, to restore brain and muscles needs to rest. Dr. Buteyko discovered it, and even in his lectures and his writings, you can see, and he was saying that sleep actually is a poison. So yes,
that's different. Okay,
that's in a way. Well, the thing is that he worked all his life as a medical doctor in hospitals with severely sick, like critically ill people related to asthma and heart disease. That was his specialty. He had heart disease himself as well. And so what he discovered in relation to sleep already in 60s, and now we know, because I have a lot of Western research saying completely the same, that actually sleep is indeed the worst time of the day, because if we think about the time of the day when people are most likely to die, you know, when people are like critical care hospitals, of course, we care about their survival. Okay? And from medical viewpoint, epidemiological viewpoint, it's crucial to know what would be the time of the day when we are most vulnerable to have like highest chances of heart attacks, stroke, you know, seizures due to epilepsy, like asthma attacks, COPD attacks, like thousands of people die from COPD attacks as well every year. And so what happens, Dr. Buteyko discovered that happens during sleep. And all Western research completely agree with that for all these conditions. And that was done by people who, like, again, never heard about doctors. That was Western research done maybe 10, 20, 30, 50 years ago, which found exactly the same effect, that the early morning hours were most dangerous for health. And those people who are severely sick, we can tell that it's true. They feel worse when they wake up. And we know from our students as well, when people wake up and we do this body oxygen test, the CP test, you remember I described like how much oxygen you have, you get lowest numbers when you wake up. So, and that's why we believe that this is actually the main parameter that reflect your health. If you improve your morning index, your morning oxygenation, then your health definitely would be better and better. So week after week, let's say, if you continue to practice this method, you continue to do certain things. It's not necessarily to do like, let's say, Buteyko breathing exercise, because we know there are many other ways, and there are students who achieve the same using, for example, correctly done yoga pranayama, for example, or correctly done meditation. But what we know at the same time, without incorporation of all kind of battery of lifestyle factors, which Dr. Buteyko studied by details, it's very unlikely that the person would make large changes, and it would be permanent changes. So because what we do, what we monitor in our training, what our students do, we monitor how their breathing, automatic unconscious breathing change day after day and week after week. So how we progress. And of course, it may take, sometimes it can take many months. We had students whom it may take sometimes years to get significant improvements. So it depends on time investment, depends on in breathing practices. Meditation, pranayama could be used as well. Breathing devices could be used as well. Buteyko reduced breathing could be used as well. Plus physical exercise takes a big part, because Dr. Buteyko discovered that physical exercise is, he even called it as a more natural method to maintain health. So our students generally do breath work, and this is how I teach to them that if they want to make changes in their breath, then breathing exercises, in my view, is crucial. It's really, there would be very few examples, nearly no examples of people who may do it only with physical exercise or lifestyle. So you have to do something else. And meditation might be, I do not have much experience yet in statistic to tell that only meditation alone plus a lot of Buteyko lifestyle, if this method would work, it may work. It's very possible that it would work. Pranayama, I know, would work as well. Pranayama would work really well if you do it the right way. And if anybody wants to find more, I have the whole book on yoga called Written with Me and Volker Schmitz, like one of the practitioners from Germany who knows yoga extremely well because he's been teaching it for like more than 20 years in Hamburg. And so he wrote 3 practical chapters, but this book would give you really good understanding of ancient yoga because we use a lot of quotes from very old yoga books who would never tell that breathe more, breathe deeper. It's all opposite. If you find, it would be all opposite. Breathlessness is deathlessness. Many other quotes where we explain actually that breathing indeed less air, breathing slower and less is the key in yoga. And yoga masters, to my surprise, like you find some, let's say, yoga books, like let's say 60, 70 years old, they would be really smart. There are not so many of them, but there are some books you can find which are that old. And that we would give a totally different perspective on how you should practice pranayama, for example, and many other practices. And then with this yoga, I was surprised myself because you can read in them that they say, well, like one of the practitioner would say, well, as a test of my abilities, after usual inhalation, I could hold my breath like for 5 minutes.
Yeah. So what does that look like Buteyko breathing? How long are you doing this for?
Well, Buteyko breathing, again, the method is many things, including breathing exercises, physical exercises, and lifestyle changes.
Okay.
So breathing and physical exercises, we take main time because this is where you spend most of the time. Other things, we are like more kind of like tweaks, you know, kind of adjust something. Although some things could be via activities, like let's say taking cold shower, for example.
Okay.
Or barefoot walking, which actually Dr. Buteyko discovered and used both this method, seeing that we are both actually extremely beneficial for breath. To slow down breath, if you take cold shower is the correct way, or maybe even using Wim Hof way, which I just recently discussed in another interview because another person asked me specifically about like what Wim Hof, why it is like hyper and so on, how people hyperventilate that. But so Buteyko method incorporates like kind of several factors together. And long term, again, like this is a big illusion. I have like even the whole video saying the title of this video, the main illusion of the Buteyko method, because people worldwide believe that it's about breathing exercises only. Okay, and Dr. Buteyko, and that's true. Yeah, when people progress and improve, and this is in clinical trials, we would also practice 1 hour of breathing exercises. But in order to maintain good health, and that's Dr. Buteyko opinion, and I 100% agree with that. I know that it's true. People better should do physical exercise. So should better do physical exercise. It's more natural. It gives additional benefits, and people would just get like more vital body, more pleasant. Like in many respects, it's a way better way to maintain good health once we already achieved a certain level. But of course, the higher level we achieved, what happens, the more energy we have. And the shorter we sleep. So that allows them to have more exercise as well. Because, of course, again, I know exercise kind of stressful negative factor, and I know also for practitioners as well, like Buteyko teaches as well. It's for many of them, it's also a stressful factor. So, but if people make big change and if they kind of increase the intensity of exercise and duration together, when we progress with the breath, you see when people do breathing sessions, even a single session, a lot of people would say, oh, I feel like more energetic. You know, it's similar effects. Maybe, you know, if somebody did good meditation, no, you feel just more energetic, more alive, you have better focus, concentration. And that's exactly the time where Dr. Buteyko would say that actually you need really very soon, ideally like maybe in 10 minutes, go for fast walk or even jogging if you're already able, if you get, let's say, 20 seconds or higher. Like we have certain programs, certain steps at which level, which physical activities, how we are modified, because with each step there are certain changes which students need to make in order to make next step later. Because
Okay.
it's a long process, and it involves again many lifestyle things as well, which we discussed, like I mentioned, sleeping on the back, preventing of mouth breathing during sleep, and not overheating yourself, learning how to talk correctly. So barefoot walking we discussed. At certain level, 20 seconds plus, our students are taught, and this is classical again, traditional Buteyko method, how to take cold shower correctly. Extremely beneficial, especially if you try very, very ice cold water, like let's say for 1, 2, 3 minutes. So, but you have to know, of course, safety factors.
Yeah.
Because this is in the Buteyko method, of course, crucial part, like how to do all these activities so that, of course, people just get benefits and a lot of other side effects. Like mental clarity, I mentioned, let's say better quality of sleep, people lose weight, even though like a very few Buteyko practitioners even mention it, like that people naturally lose weight when we retrain their breath, we breathe slower, their breath gets, they have less hunger, we have more energy, we have more energy to do more physical exercise, so we are kind of more physically capable, but also because of less hunger, they become much smarter in a way they choose their food. So this is like Soviet doctors notice, I think in 60s or 70s, like children, for example, they have often 5-10 seconds for this body oxygen test, mouth breathing, like kind of golden mouth, like syndrome, so-called. And of course, so we could have a lot of effects, and it's known like modern children are sickest in the history of humanity, because these days you can find in this like in doctors who deal with children, they can say like there are cases of children having like, let's say, cancer or heart disease, okay, at age which is like 2, 3, 4 years old, which was never heard even in history of medicine in the past. And so we know, and this is like maybe relate to what I started mentioning at the beginning. You asked like why people forget how to breathe normally. See, people are born already with heavy breathing, and their body oxygen test would be low. So therefore, to improve it, that would take them time to and of course, first step would be always education. So
other benefits for the brain, I know you mentioned like mental clarity or sleeping better, more energy.
Well, whatever, like when people have specific symptoms and specific problems, brain related. In nearly all cases, brain is relatively like stable kind of factor of our physiology, meaning that if there is a good practitioner, he or she would be able to predict actually exactly what level the students requires to achieve in order to solve certain problems related to the brain, but that could be very different. Let's say somebody has panic attacks or general anxiety, and these people most commonly have somewhere around 10-15 seconds for the body oxygen test. Of course, if we have lower, it would be like a lot of panic attacks and a lot of anxiety. It would be even worse. So I know, and it's proven by Western medical studies as well, by Western medical studies with breath retraining, if they get even slight improvements in their breath, meaning they start to breathe slower day and night and get somewhere around 20 seconds, it would be dramatic reduction. Maybe like, again, instead of like 10, 20 panic attacks a week, we may have only 1, 2, or even less. So if we get further improvement, let's say up to 30, we would have none. No panic attacks, no anxiety, for example.
Yeah, now, that makes sense.
Somebody who had seizures due to epilepsy would be very similar picture. We would have a lot of seizures when we are low. Could be grand seizures, small seizures, small seizures, and of different intensity, different duration, but they're all devastating on health. It's like all day lost, you feel like awful for the rest of the day. They get around 20 in the morning, at 20 level, we would have already great reduction, let's say 2, 3, maybe 4 times. If we get to 30 seconds, we know that seizures completely disappear. So that's relatively easy conditions for us and Buteyko practitioners. They would know those as well. Much harder conditions would be, let's say, related to brain tumors, cancer. So glioblastomas is kind of known for that. And one of my students, like as well, I trained him 6 years ago now. He now extremely successful in his own kind of approach of specializing on brain cancer, on glioblastomas. That's his single specialty. He has people with chronic fatigue syndrome, fibromyalgia, very hard conditions as well, Alzheimer, Parkinson, and so on. But particularly, this is what he liked because he lost his friend to glioblastomas years ago. So that's kind of maybe motivated him even more, kind of to help people with this. And he had tens of cases now where people with this condition already alive for years. And if these people would do brain scan, they would be having no glioblastomas, no cancer mass tissue left, maybe only scar tissue, with one condition. This is one condition, because he had few students who were not able, for whatever reasons, other diseases, allergies, and many other health problems, were not able to improve their breath. And we know this is extremely common. So what is the requirement when this happens? This like miracle basically happens. That means the immune system starts to eliminate, to literally shred apart your tumor very fast within like weeks. For that, in order to achieve, he knows we need Buteyko, normal breathing, 60 seconds for the body oxygen test. People have 4 hours. Of course, to achieve that, people already, we start to improve, let's say with people with glioblastomas, we start to do more physical exercise.
Okay.
And we do more breathing exercises. And so for this type of program, there are much kind of more rigorous requirements, because my general like kind of view after this like nearly 20 years, around 20 years of teaching the method, learning the method, that generally there are two groups of people who have jobs, who are busy like with families, shopping, like doing and be active. Unfortunately, we don't have enough time. If we are really smart, I would advise them to take the second way, more kind of professional. But the way which we use, and that was done in clinical trials, let's say on the Buteyko method on asthma, we need to have something like 1+1, I call it. 1 hour in breathing exercise, 1 hour in physical exercise. Plus lifestyle tweaks, which I already discussed. So, and with this program, let's say there were like 6 studies on asthma done on the West. Asthmatics, people who take Ventolin or other bronchodilator medication. Not Dr. Buteyko from Russian research, from Western research, and there are all studies who definitely never heard about Buteyko. We know that it's 15 seconds heavy breathing we have. Okay. Now, when these people slow down their breath, we get up to 25, and this is what happened in these clinical trials, and that allowed to reduce the medication by 90%. So there is great reduction, a lot, like
that's
10 times less medication we had. So, and you can imagine from 15 to 25, and that was after 3, 4, 5, 6 months of trial of this practice, where we had 1 hour of breathing exercise per day, maybe similar to meditation practice in a way. You focus your breath, you try relax your breath, you have light air hunger, kind of similar. And that's kind of easy way where, again, like for people who have jobs or like whatever, like we don't have enough time and so on, we choose, and we still get this great improvement. That's from 15 to 25. But again, talking about people who want to solve serious health problems, like I mentioned, glioblastomas, we would need approach which could be called like something like 2+2. So you can imagine, 2 hours of breathing, 2 hours of physical exercise. And of course, when we are sick, when we have only 10, we can do only walking. We cannot run, we cannot do cycling or any other intensive exercise too early yet. But when we progress already 20+, we can start easy jogging. 30, 40+, we run already very fast.
That's
with nose breathing. And but in a way it's kind of hard way, but eventually it pays back, because again, if somebody managed to get again, like let's say up to 60, sleep is so short. So if somebody has 4 or 5 hours of sleep, you would have 2 or 3 hours to do intensive physical exercise, and that would be again exercise which is done with a lot of energy. And many say like exercise is totally easy. I just get like one of the practitioners last year was one of the students who got 60. He was a person who who was kind of not from the people who are expected to get this good level of breathing retraining, because commonly we know that it's kind of paradoxically what we discovered, and Misha Sakharov has videos, testimonials as well about that, that, for example, people who have this type of severe conditions like cancer, we have a lot of time because we most likely are not working anymore.
Right.
So we don't have very regular jobs. So we're searching for answers, and we likely have relatives who helping them as well. And when it's like glioblastomas, like 6-month life expectancy, very, very little time left. So we have to be really fast to search and to serve, because it's really kind of very kind of critical situation. So therefore we are able to spend and to devote this time, and we are like kind of completely in, you know, in this method, because that's kind of a chance to survive. And that's why we practice so well, and that's why we can achieve so spectacular results. But people who are again busy or another situation would be athletes, people who, let's say, spend their already life, you know, for whatever reasons, like there are sometimes many people, you know, who are kind of fanatics, you know, of sports, you know, and among professional athletes, that's particularly common, you know, we somehow enjoy exercise, even though occasionally their breath can be quite poor. We still get kind of the inclination, their body, like kind of gravitation towards physical exercise. So these people, because of this, if they manage to start to exercise with nose breathing, and the breath program helped that a lot, then we can also achieve spectacular improvements in their health. And so can achieve also like very good results in terms of the health levels from the like Buteyko table, from Buteyko viewpoint.
That's amazing. Wow. Wow. There's a lot that can be achieved with this. It's amazing. Thank you. Thank you for all that information. And so where can people find out more about you, what you do? You know, your website, you have, what else?
Yes, yeah, like, well, website, yeah, has like normalbriefing.com, more than 500 pages. It's indeed very large site. Started like 12 or 15 years ago even. So very long. And it's translated in Spanish, German, partially. So there are like these versions. And we can learn, there is a very large learning section, like in terms of learning material. Probably one of the largest because it has a lot of models devoted to specific lifestyle factors, as well as breathing exercises. Now people can find more details as well from books, because I have books on Amazon, and they're all about breath. So I have, like I mentioned, I have a book on cancer, I have a book on yoga. So I have books related to cystic fibrosis, Frolov device, amazing DIY device, Buteyko breathing exercises. The whole book devoted only to Buteyko breathing exercises in all type of conditions, like let's say people with hypertension or panic attacks. We need to do certain different exercises, which I explained, the reduced breathing exercise. And when they progress, we need to modify the breathing exercise, which I also explain in the book, plus many kind of more professional effects, more kind of detailed into overtraining effect, like what happens if people practice too much, for example. So what negative effects can occur, how you can prevent them, loss of CO2 sensitivity, another effect, click effect. And then later, like most kind of advanced types of exercises, which you can do while walking. You know, there is like steps exercise when people can practice certain breathing exercises while with breath holding, and reduced breathing while walking. So that's a kind of another, that's just one of the book. I have Normal Breathing, The Key to Vital Health, book written for practitioners, which is like about 500 pages, very, very large, with hundreds of Western studies showing that like there is actually so much proof and in Dr. Buteyko findings related to not only just to breath, which I discussed, but also to sleep, even to diet, what many things which he discovered, taking cold shower, barefoot walking. Like he developed a variety of natural techniques which allow him, even though he, like actually interesting that since he was a doctor, at the beginning he was looking for drugs to slow down breathing. Because that doctors are taught in medical schools, and he was honor medical student when he in 50s when he studied in Moscow, in the first Moscow Medical Institute. And so he was looking for drugs, and he discovered that actually paradoxically many the strongest drugs which are able to reduce breath were extremely addictive and even dangerous. And that would include like such things as cocaine, marijuana, opium, like kind of common drugs. We actually we are known as very strong respiratory suppressants. So it's actually, and that's actually why many people can die. It's a common cause of death. When people take very large doses of those drugs, they would die from respiratory suppression because we suppress it. But what happens when people take the drugs, the whole world can change. And the huge part of it plays in breathing, because breathing slows down and colors and sounds and many other things of our perception becomes very different. It's like becomes kind of normal even in a way, because breathing is so light. Alcohol has the same effect. Alcohol, when people are intoxicated.
Alcohol?
Alcohol, yeah.
Oh
Yeah,
yeah.
alcohol, yeah.
Oh, I see.
Spirits, yeah.
Okay.
Can reduce breath nearly 2 times when people are intoxicated. And we also feel more kind of more powerful as well. And the brain may work like kind of in a different way.
Mhm.
Uh, uh, and therefore we like it. But the problem is with all these things, they destroy, in many cases, in most cases, they destroy liver.
Oh yeah.
And with time, of course, it's not the way. Not only that, like of alcohol, when you have hangover, you kind of slow down your breath a lot, but then your breath gets way worse when you wake up next morning.
Oh
So,
yeah.
so that's why people get addicted as well.
Mm.
So, but the thing is, yeah, he tried drugs first, but later he switched to these alternative health methods, finding that actually there is a lot of
Yeah.
wisdom. He studied yoga a lot himself. So he was kind of really kind of into in deep research, in like studying whatever sources he had and meeting people as well.
Yeah.
So.
Wow. So definitely go get Dr. Rakomov's books and learn more about Buteyko.
Yeah, and YouTube channel is actually also has
Yeah.
more than 200 videos. I have a lot
Okay.
of videos related to various topics, health conditions, and various effects, like yeah, whatever.
Excellent.
Mm-hmm.
Thank you so much for your time. Really
Thank
appreciate
you. Thank
this.
you. Yeah.
Thanks so much.